Okay, as that's getting ready, I think we're just about ready to begin. My name is Matthew Kelly, and I will be introducing you guys to the Naperville Rehab and Medical Clinic located in downtown Naperville by the Riverwalk. Anyone who's ever been down there knows the area. It's right off the Riverwalk on Jackson at 445 West Jackson, right across the street from the park over there. The Naperville Clinic has been in business for just about 47 years, and it's primarily a chiropractic and physical therapy clinic. And Dr. Tony has been practicing chiropractor for 26 years, for 12 years at that location in Naperville. Dr. Tony has been administering regenerative medicine with Dr. Domingo, and they do such things as hyaluronic acid. They do PRP injections and stem cells, and that's what you guys are here for, to learn a little bit more about. So without any further ado, I'd like to introduce Dr. Domingo. He'll be starting off our webinar here today. And Dr. Domingo is a leader in the field for regenerative medicine, and he actually flies around the United States, and he teaches other doctors how to bring regenerative medicine into their practice. So he goes around. He's in the airport right now. He's going to be catching a flight to where are you going, doctor?
Atlanta.
You're going to Atlanta, I thought so. So he's going to Atlanta. He's going to do what he does and continue to teach other doctors how to alleviate the pain in the joints that is often due to arthritis and osteoarthritis. And so without further ado, this is Dr. Domingo, and he is going to be beginning our PowerPoint on arthritis. So let me pull this up for you here, and we'll begin. Can you see this here, Doc?
Yes. Thank you, Matt. So, Naperville Rehab and Medical Clinic. Again, as a background in chiropractic and a board specialty in orthopedics, a lot of what we do is focus on natural medicine. So that's why we believe in rebuild, renew, and regenerate. Our goals are always to avoid levels of medication and unnecessary surgeries and offer another option that helps patients get better. Our next slide will show you our office. You can see by that slide, probably in the bottom right-hand corner of the left picture is the building, right across from the beach. So given that this is a Zoom call and a webinar, on the next slide, we're introducing a lot of different treatment options that we have. Now, traditionally with medicine, we've been taught that if you have pain, you are going to take some sort of medication. If that doesn't work, surgery is probably the next option. We're here to tell you that there's other options available to you. Medicine is advanced, just as like your computers, your cars, your cell phones. Everything is changing, and you have newer options. So a lot of what we do, some of our treatment options for arthritis and other pain management issues include combining levels of physical therapy, pain medication, hyaluronic acid, lubricant for your joints, platelet rich plasma, an injection that is derived from your own plasma, and stem cells. So given that we can't see you or can't really talk to you and you guys are all muted, should you want to interact, feel free to hit the chat room. We will likely handle any Q&A towards the end. And we'd like to get you guys involved. We're here for you. We're here to provide information. We're here to give you a service and also help you out with whatever's ailing you. So, by the chat room, and feel free to mark it off or type anything in. What's going on with your body? I mean, how many people here have knee pain? How many people have shoulder pain? How many people are diagnosed with osteoarthritis? And how many people are looking for a solution? Arthritis is one of the things we treat. And unfortunately, you are not alone. As far as knee osteoarthritis, more than 40 million people in the US have knee pain. More than 300 million doctor's visits each year due to this knee pain and osteoarthritis. And this results in taxpayer dollars for hundreds of millions of dollars each year billed to insurance, mainly Medicare, for treatment of osteoarthritis. Knee osteoarthritis is on the rise. We are living longer. With the advent of technology and medicine, we are just doing better, living longer, and being able to wear and tear our bodies. Osteoarthritis is a problem of wear and tear on your body. So, from day one, when you started walking, you started wearing away at your joints. Anything you were doing with your body, sports, injuries, general activities, you were wearing and tearing. So there's been a dramatic increase in the need for total knee replacements. According to the CDC, over 720,000 total knee replacement surgeries were performed in 2013. The American Academy of Orthopedic Surgeons predict by 2030, 1.28 million total knee replacements will be performed. And this is increasing because we are living longer. The goal of today is to give you options other than surgery, save your knees, and maybe avoid unnecessary medication. So, what are the causes of knee pain? Again, knee pain is a degenerative disorder. There is soft tissue, there is muscle, there is the actual physical joints. So most commonly, as you age, arthritis, a degenerative process does take place and causes aches and pains in your joints. You could also have coinciding soft tissue injuries, ligament injuries, whether you had an ACL tear, a PCL tear, anything that wouldn't happen with sports, tendonitis, meniscus, the pads in your knees that cushion your joints, or any instability or gait issues with the muscles and the IT band. Osteoarthritis characteristics include general pain, swelling. You probably felt limited movement in joints, the snap, crackle, pop, the Rice Krispies that you'll get when you walk up and down stairs, pain and stiffness upon standing. What we're here at Naperville Rehab and Medical is to show you different ways. So very commonly, most people try some level of conservative management. When you have a little pain, you might feel something and you try to do something on your own, whether that's taking over-the-counter meds, whether it gets worse and you take prescription meds. As all of us are aware, if you've been to the doctor, we talk about weight control and losing weight to help with our health and taking pressure off those joints. Of course, exercise, walking, swimming, and the use of hot or cold ice packs, icy hot to help that out. Traditionally, again, if we have pain, we might try these conservative management solutions. If that doesn't work, medications, steroids tend to be the next option. What we're here to tell you is we've learned to add different options that are more natural, including hyaluronic acid, platelet rich plasma, stem cell therapy, coupled with physical therapy, and overall using that with about a 90-95% clinical success rate and getting patients better to avoid unnecessary medication and surgery and to get them better. So looking at a normal knee versus an osteoarthritic knee. Your normal knee on the left, and I'll use my mouse here, has good healthy joint space, good cartilage growth, keeping the cushioning. The meniscus would be right about here and here to increase the padding. And you can see the joint space is even from side to side. What we get as we age, if we look at picture B, the space is decreased. You have loss of cartilage that's wearing away at the joint. As the cartilage wears away, it may expose nerve and cause some of the pain. And because of the loss of joint space, you're going to get that creaking, that popping, that knee joint won't move as well because there's no space for it to formally glide, and you lost a lot of lubrication that should be there to normally allow your knee to glide freely. So what is that cartilage? The easy answer is the cartilage in your bone is, if anyone's had fried chicken or chicken wings, it's that glossy covering over the knee. The cartilage is that smooth covering that allows for free flow of that joint to just bend easily, flex and extend. It is avascular, so it has no blood vessels. There's no drainage and there's no nerve endings. Although with pain, the pain sometimes you get is when that cartilage wears away. Below that cartilage, there are nerve endings, and those get exposed and cause pain. as they kind of as you put pressure on that joint. Your cartilage is 80% water weight, 2 to 5 millimeters thick. So, you know, osteoarthritis, as I said earlier, is an issue of wearing away. And this started when you were when you started walking. So as the joint wears away, that 2 to 5 millimeters thickness has started to dissipate and started to cause more damage in your knees. The chondrocytes, the cells that are inside your cartilage, get nutrition from the synovial fluid. Synovial fluid is basically the fluid that's in your knees. The fluid in your knees is just like your general motor oil. It's there for lubrication. It's there for cushioning. It's the shock absorber. So for those of you that are mechanically inclined or like to work on cars, it's like changing the oil in your car. Your car has a level of fluid that's supposed to be there. It offers cushioning. As you wear and tear it, you break it down. But unlike your car, you just go in for an oil change. It's not as easy with your body. Let's go to the next slide. So your traditional treatment options, as I've mentioned, given the level of arthritis you have and what's going on, they're all designed to relieve the pain, but not fix it, because we're just doing pain management. We're not doing what's necessary to fix the joint, the wearing away, the dissipation of fluid, or the wear and tear of the joint. We'll use pain meds, you'll use your Tylenol, you'll use your Aleve, you might try bracing, worst case scenario, maybe a cane or a walker. You may even try cortisone injections. Cortisone injections are common to use for knee pain, but unfortunately cortisone injections are a strong anti-inflammatory. The joint, as I've mentioned, is a lubrication, so it's fluid. Cortisone has a side effect that it actually dries out your joint, so it actually further weakens a joint. If you further dry out a joint, and your body is made of 75% water, if you further dry out a joint, it weakens it, so you actually increase the rate of arthritis. Other traditional treatment options include RFA, which is radiofrequency ablation, which is just killing the nerve. Typically, the genicular nerve is what is destroyed to help with the pain, but the nerves do grow back, and the pain will probably come back. And then there's also the physical therapy. You know, with any sort of gait issues, pain issues, osteoarthritis, physical therapy will hopefully help some of that as we've changed what we do and how we use our body due to pain. Your over-the-counter medication, as I've mentioned, aspirin, ibuprofen, naproxen, Tylenol, you know, they're all great. They do help with pain, but they don't necessarily solve the issues. They do have their side effects. And anybody who's watched a little TV would see the little blurb at some medication on TV, and the last 5 seconds, they sputter out a lot of medical jargon on how the many side effects could be going on. Some of these side effects include gastrointestinal side effects, any vomiting. You know, these things do cause damage in your body, and yes, they do have their place in medicine to help with pain, but they should not be taken chronically. They shouldn't be taken all the time. Narcotics and opioid pain management, you know, all the other options, unfortunately, very severe, addictive. They actually cause more issues. Anything you're taking, even Vicodin, you know, the side effects are pretty severe. They're being processed through your body. Just like anything you take in your body, you want something that's probably more beneficial, that's going to help you. So medication, yes, although that has a point, is artificial, is synthetically made, and it may help you. But long term, if you keep using it, it does cause damage to your body. Just like I mentioned with the cortisone and how it dries out your joints, Vicodin has its psychological issues, its skin issues, can make it difficult to breathe. And in these growing times, I don't think you want to take anything that's going to make it difficult to breathe with the current pandemic. Physical therapy, again, anytime you have pain, anytime you have issues, physical therapy is a very good recommendation to start with. Hopefully we could correct the mechanics. But as we've talked about with osteoarthritis, it's a wearing away of the joint. It's a physical aspect. So physical therapy has its place, but what else are we going to do to help your condition? Corticosteroids or cortisone injections, I've already jumped that, so I apologize. I'm kind of playing with the slides. So back at what we do here and what we're trying to offer here with Naperville Rehab and Medical is different options that include physical therapy, hyaluronic acid injections, the lubrication, regenerative medicine with platelet rich plasma and stem cell therapy, and specialized bracing. What we've done, everything you see in that little bracket over there is designed to put together into a protocol. What we've learned is that medicine isn't just as simple as let's give you an injection, let's give you a pill. We have to do things, and what we've learned in Naperville to have what I mentioned earlier, 90-95% clinical success rate with patients, is to talk about how we can put physical therapy, bracing or durable medical equipment, hyaluronic acid, platelet rich plasma, and stem cells into a program specifically designed for you, your condition. Whether you have arthritis or rotator cuff tears or any sort of pain, everybody's still a little different. And the degree and the severity of which it's bothering you is going to differ from person to person. So how we should treat you is like an individual, not just that you came in from a specific condition, but how we could help your body and put this together in a format that's going to give you the best chance of success. So what we do, again, we don't replace, we rebuild, we renew, we regenerate. And what we're going to go over as quickly is a little bit of stem cell therapy, platelet rich plasma, and hyaluronic acid. The first one being hyaluronic acid. So hyaluronic acid, again, is just a lubrication in your knees. If you look on the image on the left, there is your normal knee, good healthy cartilage, healthy meniscus, padding between your thigh bone and your shin bone, good joint space, and fluid flowing in between, acting like a shock absorber in your car. On the image on the right, you can see that the joint's starting to wear away. As the fluid's dissipated and is no longer as effective, the joint space decreases because the molecule for that fluid's gotten smaller. It's become thin and watery. The wear and tear starts to happen. You start to get wear and tear of the cartilage. You start to get damage on soft tissue. You start to get osteophytes. And unfortunately, this is the wear and tear that's naturally happening, and to some extent is probably bothering each and every one of you. So the mechanism of action. So hyaluronic acid, again, is just the lubrication, the fluid that's within the knee. The lubrication there is, again, going to act as a shock absorber. It's going to provide smooth gliding of the joint as you flex and extend or bend your knee. It protects the cartilage. If we increase the joint space, if we increase the molecule and replace that thin watery substance that's worn down and increase it to a level where the hyaluronic acid is thick and adds more cushioning, it's going to take pressure off the cartilage, and the cartilage will actually naturally start to heal. Hyaluronic acid is anti-inflammatory. It's a pain reliever, and it protects the subchondral bone. This is FDA approved. This is covered by insurance, or most insurances, depending on what your plan is, and it has been around for about 30 years. You know, this is something that 30 years ago you had to fly to Europe to get done. In the last 15, 20 years, it's become very predominant in the United States and readily available. It is something that is very inexpensive to do. It's a series of injections, and it's helped a lot of patients get better and start to walk. A lot of patients do prefer this versus taking chronic medications and surgery because we're adding a level of help to the joint and allowing it to move freely and allowing it to function more normally and allowing it to heal, taking pressure off the joint. And I think now we're going to switch over to Dr. Tony, which Matt will gladly introduce.
Yeah, well, before I let you off the hook, I've got one question in the chat that says, how is hyaluronic acid applied? Injections over time?
So hyaluronic acid, there's different types. As far as hyaluronic acid, you know, just like any sort of medicine, any sort of food you eat, there are different types. There are the natural, the synthetic. How we do it, we've used research, and the research has showed us that the hyaluronic acid, Genvis, Suparts, and Hyaluronic, the more natural made hyaluronic acid or fluid lubrication has done better and has a better effect for your knees. The way we apply it is basically we use a fluoroscope. We use image guidance to place the needle. We get confirmation that we are in the capsule because anything we want inside the knee, there is a balloon that covers it. So that balloon is where exactly we want to put a fluid, otherwise it doesn't have as much effect. With that, we have about a 99% accuracy on our injections. And when we inject, we get the confirmation, we put the fluid in, we build it up gradually over a series of 5 injections. We still couple that depending on your condition and what you need with a level of physical therapy, probably bracing, and some people even boost it with platelet rich plasma, which you're about to hear from and hear about, and stem cells, which you're about to hear about. So we've learned to increase our success exponentially, but that's how we do the applications with the injections, and it's about a series of 5 injections per knee.
Okay, well, thank you so much, Dr. Domingo. We hope you have a great flight and stay safe and
Thanks.
come back safe and sound, okay?
Will do.
Next up for us will be, I just want to introduce Rita. She is the office manager. If you guys are going to schedule an appointment, Rita will be your contact person for an appointment. Rita, can you give us a quick breakdown of how the office is handling the COVID-19 response and what you guys are doing to make sure you're in the guidelines?
Sure. So we're pre-screening all patients. Hold on 1 second. I'm so sorry. I'm having volume issues.
You're good. You're good.
Unmute now. There we go. So we are pre-screening all patients on the phone as well as when they come into the office. And then we are cleaning and wiping everything down between patients. We are keeping social distancing guidelines of 6 feet. Everybody is to wear masks when they do come in. All the staff is wearing masks. All the patients that are in the office wear masks. And I mean, if you just, everything that the CDC says to do is exactly what we are following and what we are doing.
Okay, great. Thank you. And next up for us is Dr. Tony. Dr. Tony is the head honcho here at Naperville Rehab and Medical Clinic. Like I said earlier, he has been in the industry for almost 26 years now, and has been working out of the Naperville Clinic for the last 12 years. Dr. Tony will be discussing platelet rich plasma and stem cell. And I have had a couple of questions about insurance pop into the chat. And I just want to say, we will touch on the insurance. It's more than just a straight answer. We do take a lot of different types of insurance, but the insurance companies themselves have different guidelines for what they need to see happen first before they will cover these treatments. So as much as we want to give you guys a straight one-to-one answer, yes, this covers, yes, it does not, we do need to take a look at it more in depth and make sure that we give you the right answer based on the policy you have. So without further ado, I want to turn it over to Dr. Tony, and you're going to do the PowerPoint, right, Tony?
I did the PowerPoint itself, yes. Gotcha. So if you just, okay, let me see if I can do that. And share. Can you see it now?
Yes, we can.
All right, let me see. Let me bring it back to where Dr. Domingo left.
Can we answer one quick question? It says, where does the natural hyaluronic acid come from? Touch on that before.
Okay, the natural, that comes from actually rooster's comb. Okay, that comes from rooster's comb. I've been using that for many, many, many years. But right now there are other synthetic one that is being made in the lab, and it has a little bit of regenerative properties in it too. One thing that FDA at one point they used to think of this, the hyaluronic acid or rooster's comb, as a device, and the reason was because it was a lubrication. They figured that, okay, it's oil. It's not. It has nothing to do with cutting people or anything like that. But now they know it has a little bit of regenerative properties, so it's not just a lubrication. It actually helps to regenerating a little bit of a cartilage and slows down the breaking down of the cartilage between the knee joint or shoulder joint. So that's where it comes from. Let's see if I can start. There we go. So can you see it now?
Yes, we can.
All right. So first of all, thank you, Dr. Domingo. Have a safe flight. but put one in your chat if you like some of the things that you heard from Dr. Domingo. He is a great guy. Safe flight, stay safe, please come back to us soon. Again, hyaluronic acid or HA is a lubrication, has a little bit of regenerative properties in it. I'm going to be talking a little bit about the PRP, which stands for platelet rich plasma. This is a regenerative medicine. So what is PRP? PRP is basically is platelet rich plasma. It is a component of your own blood. So it is the plate that it travels throughout your system, throughout your blood flow in your system. And what it does, it helps with the soft tissue, ligaments, and cartilage. If it breaks down, it helps it to repair it. It is purpose of it is to bring nutrients and hormones and protein to that area. It has plenty of growth factor and cytokines, which is basically is a neurotransmitter. So how do we get this thing? When it is an in-office process, you come in, we take 1 tube of blood, your own blood, we centrifuge it, which means we actually spin the blood. It becomes 3 level. It becomes a red blood cell, platelet rich plasma, and platelet poor plasma. Now, red blood cell, it is great for life, but for regenerative purposes, it doesn't do much for us. We discard that part of it. What's left is platelet-rich plasma and platelet-poor plasma. Now, platelet-rich plasma, which is called Buffy or Buffy code, it is a very small amount between the platelet-rich and red blood cells. That part is concentration of the platelets from like 3 to 8 times what your body usually has in its blood. So in other words, we're getting all that blood, all the platelet that is traveling to your system, and we concentrate it from 6% to somewhere between 94 to 95%. And then we inject it into the area of whatever area it requires in a kind of a healing process. That healing process could be for ligament, it could be for muscle, it could be for cartilage, any place that we think after we do a consultation, we think that it will help. Now, this is stem cell activation. It is not stem cell. With that cytokines and the growth factor that we send back to your own body, it activates your own stem cells. So it has regenerative properties. It has much stronger regenerative properties than hyaluronic acid that Dr. Domingo was talking about, because it is your own body and it has a lot more growth factor in it. One of the biggest things that you need to understand about the platelet-rich plasma is there is no side effect, because we are getting it from your own body, and it can be used for anything. So it can be for somebody is from 15 years old to 90 years old. It could be anybody at any age. So if it is a chronic condition, it could be months and months, or you've been getting pain and discomfort. It can be used for that. It could be acute sprain strain. It could be used for that. You could twist your ankle. It could use for that. People who have been having persistent pain, they've done maybe PT, have done, as Dr. Domingo was talking about, NSAIDs and, sometimes even a steroid injection, and it didn't work. Well, this is going to work great for those conditions. And it's a simple 30 minutes, in-office procedure. Truly, the first 15 to 20 minutes of it is for centrifuging of the blood. So usually it takes around 5 minutes to do the injection, depending on where we do the injection. Doc was talking about, we use a fluoroscopy, which is basically a live X-ray. And I'm going to go over it a little bit farther down the road. This is something that I've used. Everything that we do talk about, we actually, all the doctors in here, they have used it themselves before. I personally have, I exercise a lot, so I've had torn tendons on my elbow, and so we did a PRP. It is on a website. If you go to Naperville Rehab clinic.com, you can actually see the video for me getting the injection for my elbow, as well as stem cells. We've done it. I've had disc bulging and disc herniation. I used to be a wrestler, so I did it for my low back, for my disc bulging, disc herniation, and stenosis. Dr. Domingo, he was previously he was a hockey player, so he really beat up his body too. So he has had it for his shoulder, he has had it for his knee, and he has had it for his ankle. Dr. Ublas, which is basically he's our neurologist. He's the one, and our nurse practitioner. They are the one who actually do all the procedures. They had these procedures done too. You can see some of those things in our website. And some of the questions that they ask about the, PRP, if there is any side effects. All right. Remember, some of the components of the PRP, platelet rich plasma, is white blood cell. What does white blood cell do? It protects. It goes in there and gets rid of some of the damaged tissue, gets rid of the bacteria, gets rid of the infection of viruses. So it creates it's an army. Your army fighting anything that is in your body. So it creates a little bit of a inflammation. But when we inject it, this is a controlled inflammation. We actually want that inflammation. So it goes in there, it gets rid of some of the damaged tissue and creates a little bit of what we call a scaffolding. That scaffolding is basically getting it prepared for your growth factor and send information to through the cytokines or neurotransmitter to your own stem cell to come over and start fixing this area. So that there is a little bit of inflammation. That's the only side effect. For a day or two, you might feel a little bit of redness or swelling. Are there any rejections? Of course, there's no rejection. This is your own body. This is your own blood. There is no rejection. You can't reject your own body. And of course, is it FDA approved? It is approved, and it is, they're working on to use it for other conditions other than regenerative therapy. At any time, if you like the things that you hear, please go ahead and just on a chat room put a 1, and if you have any question, put a 2 and ask the question. At the end of it, I try to answer as much as possible. Next thing. Okay, so next thing is stem cell. Stem cell regenerative medicine has been in use for many decades for different kind of a condition other than regenerative medicine. So they've been using for leukemia, lymphoma, any kind of a blood cancer. I think it started around 1930s. So they used to get that and get it from the hip bone, your bone marrow, and get the stem cell from that one and inject it back to your body, and hopefully we get rid of the cancer. Now, past few decades, or probably past 2 decades or so, and they've been using it for regenerative medicine, mostly in Europe, and they're a little bit more advanced than we are when it comes to these things, or a little bit faster. They bring it out to the public than we do. So they've been using it and having great success with it. So what are the stem cells? Okay, stem cells basically is a raw material for your body. It serves to basically regenerate and repair any broken part of your body. It could be bone, it could be ligament, it could be muscle. That helps to regenerate and repair it. Now these cells are what we call, it's the root, stem cell, it's a root. So as these cells come out, there are other specialized cells that comes out from these stem cells, and they have different functions. The one that we use is called mesenchymal stem cells. Those cells are for regenerative purposes. Those cells come from cord tissue, they come from amniotic fluid, and now they call it actually medicinal signaling cells or cytokines. The reason they say that is because they're saying there's a lot of signaling happens in your body. That's how your body actually regenerates. There are pericells. What does pericell means? If anybody has gone to any kind of a museum that is body works, there was this Japanese doctor. What he did, he took a person's body, he infused some rubberized material into the body, in the arteries, and dissolved the rest of the body. So what you see over here in this picture is the actual person, and you can see how much of a blood vessel. I mean, you can actually see the form of the person. So that mesenchymal cell or medicinal signaling cell is sitting on every part of these arteries that you see over here, or blood vessels. So they continuously, through the signaling, they tell each other that we need to actually repair or regenerate certain area of the body. So where do these stem cells that we get, where do they come from? Okay, there are a few different ways that we can get the stem cells. There are embryonic stem cell, which is not being used in the United States for in a clinical or regenerative purposes. That is illegal in this country, and we don't use it. And I don't think anything but the research department, maybe even sometimes just in Europe, they use that. So the other forms of the stem cells are bone, comes from the bone, and it comes from the fat, your own fat, umbilical cord, and amniotic stem cell or amniotic fluid. Again, as I mentioned, embryonic stem cell, not amniotic. Embryonic stem cell, we do not use, that is illegal. We do not use that. So there are two ways that we can get stem cell. There are one that we call it autologous stem cell. What is autologous stem cell? It's a stem cell that we get from bone marrow or fat. Now, bone marrow, most of you might have heard people saying, donate your, bone marrow, come on over, see if you're compatible. So they actually go into your own body. They put a hole into your pelvic. They drain some of the bone marrow. They process it through certain systems, certain devices, get as much stem cell as possible, and they inject it to the area that it requires it for healing and regenerative purposes. Second one is the fat stem cells. Now, there are a lot of good stem cells in the fat, and what it is, they go in there, again, same as the bone marrow, they go in there, they do a mini liposuction. You're gonna see it is an invasive procedure, both of them, it is an invasive procedure. It requires, surgery and some downtime, but they process it, and actually, depending on how much of a stem cell that they get from you, they put it back into your system, to your body, and hopefully that will regenerate what needs to be regenerated and healing. So one of the biggest problems with those two is age. As we grow older, the number of stem cell or medicinal signaling cell or mesenchymal cells that we have, it diminishes, it decreases. So when we are born, if you look at this one, when we are born, we have, out of every 10,000, we have one mesenchymal cell or medicinal signaling cell that we see. As we grow older, by age, let's say around teenage years, 1 out of 100,000, you're gonna see that there is a mesenchymal cell. So the numbers is increasing. So there's like 100,000 to look for, and you're gonna find one mesenchymal cell out of that one. By age 50 is 1 out of 400,000. Unfortunately, and by age 80, well, 1 out of 2 million. So unfortunately, one of the biggest things you notice is as we grow older, which has happened to me, myself personally, as we grow older, we don't recover as fast. One of the biggest reasons we don't recover as fast, or we don't regenerate as fast, is because, well, one, the number of mesenchymal cells decreases. Two, they get lazier. They get a lot lazier. They've done a lot of work. There's a lot of mileage on us. So what you see, what you used to be able to do as a teenager, you used to be able to go beat up your body, and you used to go and, exercise for 3-4 hours. The next day you get up and you do it again, because you had so much mesenchymal cell or medicinal signaling cell, stem cells, that your body could recuperate fairly fast, and you could do it again. Now, same activity at age 50, if you do, you probably, just like myself, you're gonna need around a week or so to recover. The reason we don't regenerate as fast, our stem cells are not as active that they used to be. Okay, so I'm sure, go ahead, anybody who's had this issue, and I'm sure a lot of us are laughing about it. Yes, I know, when I was teen, I used to be able to do it. Now I can't do it. Put a 1 on the chat room. Anyway, one of the biggest thing about the stem cell, it is anti-inflammatory. One thing it needs to be told, it is anti-inflammatory. It modulates your immune system, and it is great for regenerative properties. Okay, so amniotic fluid is what we use. Amniotic fluid and the cord blood stem cells is what we use. Now, what is amniotic fluid? Amniotic fluid is colorless. It surrounds the baby in mother's womb. It is, it's something like cushioning the baby, and of course it protects the baby against infection, bacteria, and viruses. So it was helping the baby grow. This comes, when the mom usually goes, after giving birth, This comes from a placenta. And in old days, they used to take it after the baby was born. They used to call it the afterbirth. They used to take it out as a medical waste and incinerate it and burn it. Now they know that a lot of good cells, they call it golden cell actually. Some doctors, they call it golden cells because they can actually help to regenerate a lot of different parts of your body. And the evidence is there, and it's more and more getting, that's why you get to see a lot more clinics are using it for regenerating and helping your body to heal. Umbilical cord, exactly what it is. It's umbilical cord that was between the baby and the mom. And of course, what it does, it brings nutrition, oxygen to the baby, and it helps with any part of your body requires, healing requires oxygen, and that's what it does. There are a lot of studies going on right now with stem cell from umbilical cord amniotic fluid. They're using it for Alzheimer's disease. They're using it for lupus. They're using it for multiple sclerosis. They're using it for stroke. Stanford Medical University is using it for stroke. They're giving it, drilling a hole in the head, and they put the stem cell in there, and people who were unable to walk start walking. Remember, it is regenerative. It doesn't mean they get up and walk right away. It takes a little bit of time, but they start walking, or they were, wheelchair bound. They start walking. They're using it for multiple sclerosis, and of course, in Duke University, they're using it for autism spectrum. In our clinic, we're using it for regenerative medicine. We don't use it for any of those conditions. But in reality, the paradigm and the healthcare system is changing from replacing and putting artificial stuff in your body to help your own body to heal itself. Okay, nothing can replace your own what's God-given body part. So where do we get this? How do we get it? So a mother that is under 35 years old, healthy mother, goes on a scheduled C-section. On the 9th month of the pregnancy, they go to the hospital, specialized hospital. Not every hospital does that. They go in there, they get checked for every diseases and abnormalities and genetic malfunction that there might be. They get tested for everything there is. Once they are cleared, as I said, they're scheduled for the C-section. They go to the room. They're a specialized doctor. They're in there. They do the C-section. Mom is fine. Mom goes to her room. Baby, she or he is fine, goes to her or his room. And what was left again as a placenta and a cord blood that they used to burn, now there are a couple of doctors and the technicians are there in a very sterile manner. They take it to the lab that is just very close to the hospital, and they call it they're cleansing it or cleaning it. What they're doing, actually, they get rid of all the DNA factor, all the HLA factor, anything that it could make your body reject that cell. They take care of it. They get rid of it. So what's left is pure stem cell, mesenchymal cells that it can be given to me, can give it to Tom, Dick, Harry, Jane, Jean, and there won't be any kind of a rejection. The reason is because it has not been defined for one person, so it can be given to anybody. So, of course, the way they get it is, the cord blood amniotic fluid is FDA approved lab is using it, and they go according to American Association of a Tissue Bank and current good tissue practices. They decrease the temperature once the cell comes out to minus 80 degrees, so the cell is not going to be aging, so it's being dormant. And they keep it in the lab. We only ask for the stem cell from the lab when we have a patient that is scheduled. Once a patient is scheduled, we call the day before, and they overnight send it in a dried ice. It comes over, stays in the dry ice till the patient walks in. We take it out. It takes around 15 minutes or so. We thaw it out, and the way we do it is a little bit different than the other clinics. So we actually add a little bit more, like PRP to it, and we inject it to the area that we think, according with patients, to see, to help the patient to recover from their injuries. So as I said, again, it is a regenerative medicine. It is a new paradigm in healthcare. It is non-operative. That's a beautiful thing. It is non-operative. It is a low risk. It is outpatient, and it is very effective. And, this is something that we all be looking for. We used to, every clinic, when I do a physical medicine for past 26 years, we knew there was some kind of a limit to what we do. And after a certain amount of healing the patient, helping the patients, when they weren't getting any better, we used to send them to the orthopeds that we are in communication with and work with. And of course, they get a surgery. Now we found a way that we can actually mitigate. We can actually have a middleman right over there to avoid the surgery. So we're going to have the surgery for the last resort. I mean, most of my patients that come over, they either had one already done. Let's say if we talk about knee or shoulder, they already had one done, and they really didn't want to go get the other one done because they had a bad experience. So when it happens, good, they're great. But when it doesn't work, they're in really bad shape. So plastic surgery, one of the example, plastic surgery is, 20 years ago was around 90% operative. They used to do operation. You don't see that too much anymore. What you see is 90% non-operative. What they do, there's a lot of, PRP injection. They do a lot of stem cell injection. So this is, they go in and they get out without any downtime. Again, stem cell, the benefit, it is anti-inflammatory. It modulates your immune system. What it means it decreases inflammation. It brings it down. Inflammation is good, but up to certain points. When it gets over inflamed and it breaks down your own tissue and it causes damage, that's when it's not good. So stem cell actually modulates it, dims it down. It's a dimming switch. Okay, it is immunologically privileged, which means you do not reject it. And of course, it relieves the pain because it decreases inflammation, and it is regenerating, and it regenerates muscle, ligaments, tendons, and cartilage, depending on what we need to work with. Again, as Dr. Domingo was showing, normal knee and osteoarthritic knee. And of course, we use this thing for hip, knee. I did it for my low back, as I said, for disc bulging, disc herniation. We have done it for the cervical, for the neck. We use a fluoroscopy. We don't do anything by chance. We don't do anything by just guessing if we are putting it in the joint. So we invested a lot of technology into a clinic for past few years. Fluoroscopy is a live X-ray. So when we do the injection, we look at your knee or shoulder, depending on what we do. We look at it. We look at the joint space to see where your joint space is. Again, what Dr. Domingo was mentioning too, we put the needle in there, put a little bit of a dye. Once we see that it's confirmed that the dye is in there, we don't take the needle out. Of course, your knee is numb, so you don't feel anything. Once with the confirmation of the dye is inside your knee joint or a shoulder joint, we take the syringe out, we put the stem cell or PRP, and we inject it right in there. So all the goods are in there. We don't do anything blindly. So we are basically making sure that you're getting what you're paying for. Stem cell therapy is used for anything. As you see the picture, these are the ones that we've been using a lot for. We specialize basically in this type of a condition. And this is some of the pictures of the stem cells before and after. They've been using it for many, many years. Again, it was expensive for very only a few people can use or afford it, which is basically elite, not necessarily elite, but people who had money, lots of money. So they were able to go to, as I said, Europe, spend the money, get their stem cell or PRP and come back. Now, past probably around 5 years or so, it's been so popular over here. So the financial part of it is gone down. So it's helping, and we're helping a lot of patients to get this. So as Dr. Domingo was saying, is hyaluronic acid, is it covered by insurance? Most insurances, just about all of them, I should say, is covering it. Hyaluronic acid is covered because they've been getting it great results with this one too. One thing before I go that far, if there was an Olympic right now, in Olympic, there's a gold medal, silver medal, and bronze medal. I would say hyaluronic acid would be the bronze medal. It's still very good because it beat up a lot of different kind of a therapy, but it is a bronze medal. Then silver medal would be the PRP. So you notice that it's a little bit better. And you have a stem cell. Stem cell is a gold medal. And that one, the reason it's gold medal because it covers the PRP. In that stem cell, you do have PRP. In that stem cell, you have that lubrication or hyaluronic acid. That's why it's a gold medal. So we like stem cell. But the other ones are great depending on your condition. If it's not broken down too much, If you go with the hyaluronic acid, there's no reason to go with the PRP or stem cell. All right. Is PRP covered by insurance? Unfortunately, it is a revolutionary, medical procedure. As I said, they're going to advance and get more things done with the PRP, and it hasn't captured the insurance attention yet. Just like hyaluronic acid, it wasn't at one point. Just like LASIK, it wasn't at one point. Now it's covered. There's no problem. So this will get covered soon. We don't know exactly when. This is insurance. Your guess is as good as mine. Is the stem cell covered by insurance? Recently, they started covering it. So depending on your plan too. So depending on your plan, yes, it is being covered, depending on your insurance too. So what we do, we actually verify this before the patient comes over and gets it. So we want to make sure that they pre-qualify first of all, because not everybody can just walk in and say, okay, I want a stem cell and let's get it done. They have to, an insurance company is not your friend to say, okay, we're going to give it. You have to pre-qualify. What have you done? What have you done to help yourself? What kind of a therapy have you done? If you've done certain amount of therapy and they see this still not getting any better, they prefer for you to get this stem cell than pay for $65,000 worth of surgery and of course physical therapy post-surgery. So depending on your insurance, yes, this is covered and we can actually verify for you. I personally can't. We do the clinical part of it. Rita and the rest of the insurance people, they can take care of that one for you. Of course, if none of those happens, let's say you don't have any insurance, of course there's the clinic offers care credit. Again, Rita would be the one that point of contact for you. It would be 0% interest for 6 to 12 months. HSA and FSA is of course covering it too. With that said, I think I'm done. So please, help you. If you have any question, go ahead.
We've got a few questions for you here, Dr. Tony. This one's from Paul. He says, I'm interested in learning about which treatments would be applicable as a preventative treatment to minimize regenerative issues post-meniscectomy to be able to continue activities like running.
Okay, wonderful. It was Paul, right?
Yes.
Paul. All right, Paul, thanks for the question. One of the biggest things I wanted to, I think maybe Dr. Domingo mentioned it, or if he didn't, meniscus is the cushioning. Meniscus is it's a washer between your thigh bone and the shin bone. I'm not a fan of meniscectomy. One of the biggest things is because once the meniscectomy you go through it, you have decreased the distance between the thigh bone and the shin bone. Now you are prone to get osteoarthritis faster. Now, that said, you're a runner, so you're kind of pounding it a little bit more. Depending on what it was done, I don't know exactly how bad the meniscus was. Meniscus does repair itself, depending how bad it is. Yours might have been bad enough that it required surgery. I don't know. But regenerative medicine with PRP would be number one thing because you already had surgery done. So we want to repair something. Hopefully, we can regenerate more of your meniscus. Stem cell, again, is top of a line. You can't go wrong with that one. And since you already had the surgery done, that's something I will look into. More of a PRP and a stem cell as opposed to hyaluronic acid, or combination of both, depending on what we see on an X-ray too. And that's individualized. I hope I answered it.
Great. And we had another question said, what is the success rate for stem cell?
For stem cell, again, the younger you are, the better it is, of course, because then what we're doing, when we do the stem cell, one thing you have to understand, when we do the stem cell, that stem cell that we put in your body is brand new. It's ready to fight. It is give me something to repair. It does that for you. Beside that, once it goes into the system that we put in your body, wherever, let's say to your knee, it activates your own stem cells. Okay, so because they work based on signaling. What did I say? Medicinal signaling cells. It sends signal to you, the rest of your body, to, hey, we need repair. So it helps to repair any other parts of your body. So let's say we put in your knee, you might feel better in your hands and fingers because we activated your own stem cells. 80 to 85% success. Now, what do you call success? I wouldn't be able to do somebody who is like 80, 85 years old, 90 years old to feel like they're 20. So you're not going to be running, okay? But my success would be somebody who's able to walk for a long period of time, with no pain. Being able to go upstairs and come downstairs, and that was their limitation. They couldn't do that, and they feel much better. Now they can do it with no pain. To me, that's success.
Okay, and before I go to the last question I have here, if anyone else has a question, please feel free to either submit it in the chat or in the question feature. I'm also about to launch a poll, so please fill out the poll. If you'd like to schedule a consultation with us, we have appointments in the clinic that we can accept, and we also have virtual consultations where you could do a video conferencing with Dr. Tony. So if you guys see the poll, please let me know. And then if you just like to answer that, we will reach out to you directly. So last question, Dr. Tony, is can this be used on back discs or back tendon tears?
That's what I use for me. As I said, if somebody comes over consultation for in office, you get to see my MRI. I used to, as I said, I used to be a wrestler. I had 4 major car accidents, so it really beat up my body for my neck and for my low back. And I have used it for my low back because I have disc bulging and disc herniation as well as stenosis. So yes, that was a long answer for yes, it can be done.
Okay, and I'd just like to keep the floor open. I see we've gotten 9 people, about half the people have responded to the poll. And okay, we've got another question here from Diane. I know the areas I need can be treated. My husband has some back discs degenerating and is on tramadol over 2 years for soft tissue injury in a scapular area. Additionally, has some short-term memory issues due to a concussion. So is that something that could help?
Okay. Okay. Let's put it this way. If in 2 years of taking tramadol, it hasn't helped, it won't help. So staying on top of that type of medication is not going to help. I'm not saying don't take it for pain, but there are alternatives. Yes, this is what we do. There are alternatives. That's the reason we brought this. That's the reason we're doing this webinar is there are alternatives to medication. And this is alternative. There are alternatives to the surgery. This is the alternative. But for something like what we're talking about for your husband, between shoulder blades, I want to look into it for hyaluronic acid because really hyaluronic acid is between the joints. And that the way that she is talking about is not really between the joint. It's a little bit different. So depending on what we see, I would say either PRP or stem cell, depending on what the condition is. So it does help depending on what it is.
Okay, great. And then lastly, if you would like a copy of the video replay, it's going to take us a day to edit the video. But if you'd like a copy of the replay, please go ahead and put a 1 in the chat, and then we can be sure to send it to you over email. Okay, great. I see a couple ones in here. If anyone has any questions for Dr. Tony, you know, he has a few more minutes for us here.
Yes.
So if anyone has any questions that they'd like to ask, please feel free. You can either type it in the chat, or if you type a 2 in the chat, I can unmute you and you can ask him directly. So we'll give it just a few more minutes here.
All right.
But for everyone else, if you did request a consultation, we will reach out to you tonight and try to schedule that with you. If we can't get a hold of you tonight, we will just follow up with you tomorrow.
Thank you again, Matt. Appreciate it. Thank you, everybody. Stay safe. These are the times that we have to do these things. I used to do this one-on-one in the clinic, but now these are the times we got to do it this way, unfortunately. And, you know, wishing everybody well and stay safe.
Wait, before I let you go, Dr. Tony, I've got a couple more here. How about IVIG therapy? Can we help with that?
At this time, we don't. At this time, we don't do IV. We have our nurse practitioner. We're talking to her to be able to do it. Hopefully, within a few weeks, we're gonna start doing the IVIG. But right now, not yet. Okay, we're gonna start doing doing the vitamin D and vitamin C mega doses through the infusion. We're gonna do the infusion depending on a nurse practitioner because she is busy doing what we do right now. So we're gonna have to find a little bit of a time for her to do this. So as of now, no, but leave your number. whoever is asking. And as soon as we start doing this, because it's a great therapy too, as soon as we start getting that, we can let you know that come on in.
Okay, then thank you all for joining,
Thank you.
and we hope to see you in the clinic before too long.
Thanks, Matt.
Thank you, everybody.
Bye.